Buenas tardes, bienvenidos a nuestra
Good
celebración.
afternoon. Welcome to our celebration for the 3 years of CONECTAR, also as part of the celebration of Minority Health Month. And the topic is we want to be the source to improve the health of our communities, taking advantage of our cultural richness and our connections. Speaking about connections, I'm going to tell you a story about CONECTAR, the history of CONECTAR. We are a group that was established formally in the fall of 2021. And it is a communication network that wants to go back to the communities to transform and reconnect. That's why Conectar in English. This group was developed out of the need to address COVID-19 pandemic issues as a public health issue. If you may remember, there was some misinformation about it, and there was the need to provide information about health that was reliable, trustworthy, and on time. So this is a group that came up as part of those efforts. So this group, this is a group of doctors from different specialties with different histories, coming from different cultures, different languages, and that really prove the diversity of Mass General. We form a group that is, medical liaisons, which is going to be a connection between the community and the hospital, community and the health providers. So we developed this initiative called Conectar so that we could provide information about health that could come on time, be trustworthy, and to be culturally and linguistically sensitive. So this happened because of the relationships that we had with our partners in the community, especially the media partners, the local media partners. So who are these medical liaisons? We have here three of them on the screen. The first one, Dr. Claude Alabre, who is a primary care physician, and he has been very active. He has worked with this group. We have the very famous, very popular, well-known Efren Flores, and he is a radiologist, and he also works at Mass General, myself. And I work at the psychiatry department. I'm the director of the program, the addiction medicine program. I also wanted to tell you a little bit about, after telling you the story of CONECTAR, I wanted to tell you what we have been doing. And what we have been doing is, first of all, as I said, we have been working with our media partners, multicultural media partners. For now, we have 5. We are planning on extending this network. We have been working mostly with communication media in Spanish. We have El Mundo, El Planeta, Las Parceritas. We have our friends in Colombia. We have Univision, and as we said before, we have WebGym. And we are trying to reach the communities that speak English, Spanish, and the Caribbean communities. And between the fall of 2021 and January 2024, we were able to achieve 96 episodes or segments with different multicultural media segments. We have been able to discuss more than 50 different topics about health, social cultural issues. We have discussed diabetes, maternal health, depression, problem with children, older adults. We have discussed COVID a lot, COVID vaccine, how to not get COVID. We have talked about mental health. And also, we are super happy that our audience really goes beyond. We have over 500,000 people listening to us, and that has been through social media, the internet, and other different written publications. And who has helped us a lot? And we're so thankful. We have 63 doctors from MGA, the MGH, are experts in the field that have participated. They have been the ones to provide these communications. And these experts come from 25 different specialties. For instance, we have some physicians that are general medicine. We have pediatricians that see children. We have infectious disease specialists. We have psychiatrists for mental health. We have palliative care. We have radiologists. We have emergency doctors, people that work in emergency departments. We have pneumologists, doctors that know about your lungs. We have specialists in older adults. We have gastroenterologists. We have oncologists. We have a great number of specialties. And We have many, many countries represented here as part of this group. We have doctors from Puerto Rico, we have doctors from Mexico, we have doctors from Ecuador, we have doctors from Italy, Peru, Argentina, Colombia, Brazil, El Salvador, the Dominican Republic. We have many, many countries that are represented, and therefore we have many, many languages also represented. We have Spanish, English, we have Creole, and we have Portuguese. And as I mentioned earlier, we have our partners, our media partners, our dear friends at these multicultural media organizations. As I said, we have El Mundo, El Planeta, Las Parceritas, Univision, and Java with Jimmy. And I'm now going to introduce to you our dear doctors that are going to be moderating the program today. Efren Flores, as I said, he's our dear doctor from Puerto Rico. He's a radiologist. We have Dr. Wendy Macias Constantopoulos representing Ecuador. She is an emergency medicine doctor. And you have me. As I said, I work in the addiction medicine department in psychiatry. And we also have the panelists today. We have Alexi, Lynette, Karin, and Linda. They're going to introduce themselves right now.
Hello, I can get started. Greetings. I'm Dr. Karin Davila. I studied internal medicine, but now I specialize in palliative care here at MGH. I support patients with serious diseases who are hospitalized. Pleasure to be here. Hello, my name is Lynette Bosques Nieves. I'm from Puerto Rico. I'm now finishing my internal medicine training at MGH. In July, I will be starting to train as an oncologist in the Dana-Farber Mass General Brigham program. It's a pleasure to be here. Hello, Dr. Linda Herrera Santos. I am Mexican. I did my training here at MGH, and now I am working, or part of my job is to provide mental health care for patients who speak Spanish. And to get started, we're going to have several questions for our panelists. I'm going to start with Karin. Karin, if you can, could you tell us a little bit about has this program has impacted you both personally and professionally? Yes, thank you. I had the pleasure of being part of a team at the beginning of the pandemic that wanted to provide information for our community. As Gladys said earlier, it was pretty difficult to find reliable information sources, so you could hear what reality was at a very scary time. So we started small. We produced videos talking about the symptoms and how people should isolate themselves, and also about how the pandemic was progressing, how to get a COVID test, how to do a home test, or when to go see the doctor. So it all started out of need during the pandemic, and it gave us an opportunity to connect with our partners in the media to say, well, there are many other subjects that people want to hear about. Sometimes maybe they want to hear from a doctor who speaks their language and who can tell me directly what are the things I need to understand. For example, my specialty, palliative care, how is it different from hospice care? And also to get information from somebody who's a specialist and who can provide certain information so that patients can understand it and know what questions they should be asking their doctors. So it's been an opportunity to continue connecting, to have an opportunity to share with patients in our communities, sharing with experts, like many of my colleagues who are experts on their specialties. Thank you very much, Karine, and continue the conversation, just a casual conversation to learn from our experiences. Lynette, can you tell us how this program has impacted you, both personally and professionally? I loved it because one of the reasons I came to MGH is that they had confirmed to me that I was going to be able to provide healthcare for Spanish-speaking patients. When I started my internship in 2021, I had 60 patients, 33% of them spoke Spanish. In fact, one afternoon at the clinic, all 5 patients spoke Spanish today. And I am saying goodbye to them. And it's been a great experience. We hugged, and, Latino patients have a special place in my heart. So it's been a great opportunity to talk to Spanish speaker patients who remind me of my family, my dad, who lives in Puerto Rico, does not speak English. So for me, both professionally and personally, has been great to be able to discuss these issues that sometimes, because of the fear of not understanding it, sometimes we as health professionals, we don't do a good job explaining medical terms. We don't have the time. So it's been great to be part of this group, and belonging to CONECTAR has allowed me to have more time and to make the effort to bring this information to different communities in Boston. Thank you. And Linda, the same question. Yes, being part of this program has had a great impact on me, and as a psychiatrist, a great part of my job every day is to provide information on mental health. And being part of this group has allowed me to connect deeper with the communities that I serve in my job. And something very important is that in my clinical practice, I have realized that when you provide the appropriate information, culturally relevant information, you can change lives. So reaching so many people through CONECTAR has been a great experience, being able to provide this information in the language of the people who are hearing us. And of course, I am a psychiatrist. So on issues of mental health, we know there is persistent stigma, and providing this information, broadcasting this information in media with such high reach has been important. It has given me the opportunity to collaborate with other great health professionals like my colleagues here, and other people committed to the well-being of the communities that hear us and listen to us, in particular Latino communities. And that has given me the opportunity to continue growing, to continue learning. So it has been a very gratifying experience, and I'm very thankful of having belonged to this important group. Thank you very much. I agree with all of you. This is really, it's an honor to be able to bring information to our communities and to really work on health in a way that everybody can understand, and being able to help the community to be healthier. I'm going to give the floor to Gladys. Thank you. Let's see. We have the following question. It says, thank you for telling us why you participated in CONECTAR. But now that 3 years have gone by, what keeps you committed and connected? And why do you want to keep being a part of CONECTAR? Karim? I would say it's many of the same things. Having the opportunity to connect with our communities, to speak to people, to partners in the media who have really grown their audiences, and being able to show our real face. We're not just academics, we're doctors, we're here to serve our patients and our community. So it is having the opportunity to discuss these issues, as Lynette said, with a language and in a way that's easy to understand, because all our communications really should be made in a way that our patients can understand without having the need for years and years of study, because we are trained sometimes in a language that people who have not attended medical school won't understand. And we have the responsibility to communicate that information so our patients have all the necessary information to take care of their health and to work with us to promote their health. So, having that opportunity to continue to connect is a privilege. I've happily done that during the last 3 years, and I hope to continue doing it. Thank you. Really a privilege. Lynette. Yes, I did not start in 2021 like Karina and Lynn, but it's been a little bit over a year. And the reason I have continued is because it's a privilege, and we all agree here that it's our duty to help our community, since we've had the opportunity to reach a position where we can help so many people. And I feel that this group has never forgotten where we all come from, and it's our responsibility, it's our role. And every day I go to bed thinking, well, it's been great to help people in the hospital. And mainly if it's a Latino who doesn't have the resources, who perhaps doesn't understand English. So this group offers them an opportunity that's not that easy to obtain in a hospital sometimes. Yes, we are unique. Okay, Linda. Yes, I agree with everything's been said already. And I think that a very important part of it is that I believe in the mission of this program. It's so important to provide mental health information and general health information in a way that is appropriate for the communities that are listening to us and that perhaps would not have access to this information otherwise. So that's a very important aspect. Many people don't have access to healthcare information, and they are receiving the information in this fashion. So I continue to be committed. I started in this program when I was a fourth-year resident, and I continue to be committed because I see the positive impact this work has on people's lives. Like Lynette was talking about her parents who only speak Spanish. My parents live with me. They only speak Spanish, and they obtain most of their health information from media, from the news, from TV, from Facebook. That's the reality. So it's very important that people have access to trustworthy information. That's correct. Thank you very much. I think that what most impacted me of what you said is the responsibility that we have uh, with the community. So I'm gonna let Efren talk now. Okay, thank you very much. Listening to the conversation, really, this inspires me and gives me a lot of pride and brings a lot of memories about the path followed, and not only about how we communicate, we connect with our Latino community, and but also how we connect amongst ourselves. We would not be connected, being in different specialties otherwise, and that sense of community in the hospital is something that really fulfills me and gives us a sense of the mission that you were talking about. It's the reason for being, and like Linda was saying, how her parents consume information mainly from the media, and that's one of the things we wanted to ask you about, and it is what's the impact that you have observed in your patients and in the communities through CONECTAR? Let's start with Lynette. She's from Puerto Rico, like me, so.
Just so that everybody knows. I would say that something that Linda said that really appealed to me is that you have to be very careful because there are really a lot of myths in social media. So many times I get patients that come to the office, and obviously they do their own research on social media, not just in Spanish, not every patient, not just the ones that speak Spanish. Even I do it myself. Whenever something happens, I go on Google, and sometimes I look up things there, and it's not really trustworthy. So to have this opportunity, not just to be able to explain to patients, explain things in our own language, but also clarifying things. And in fact, CONECTA has this segment that talks specifically about how to eliminate myths. And there's information, concise, brief, and there's so many myths out there. And I realize now that a lot of the things that you share on social media and the things that people see, people, same culture, same family, sometimes we get ideas that are wrong. So this opportunity is great to be able to clarify what those myths are. And that has been really incredible for the community, for my patients when I see them at the clinic. Thank you, Lynette. Linda? Yes, 100% in agreement. That is something that is so gratifying to be able to give people the right information, correct information. And the truth is that it is an important impact that you have. And I see this, as we mentioned before, when you see people that speak Spanish in the clinic and they mention to me, well, I found this information and information they received. For instance, they talked to me about a minute of health and information they heard there. And it is incredible the reach that our information has right now. And as I mentioned earlier, the most important thing is many of these communities really do not have access. These are patients that are receiving healthcare, but there are many people that are listening to us that do not have access to healthcare. And the opportunity to be able to provide this correct information, reliable information, it's very important. Wow. So, Jarim, what have you seen? Well, I remember one of my events, my favorite event. It was the Hispanic month that happens in the fall. It was an event with Java with Jimmy and with Gladys and Efren and Claude. And we just had a conversation about what are the things that we should think about and how it was received by those people that were in attendance at the event. They told us, oh, wow, we never get an opportunity to listen to this kind of conversation. Not just one physician, but 4 physicians and everybody with their own perspective and their own personal opinion. And at the same time, everybody had a lot of interest in advancing education. And I agree with Lynette on this idea that we should try to stop myths and provide people with reliable information. And we're all interested in doing that. And we want to advance health. And we want to provide information to our communities. Thank you, Karin. That's such a nice memory. And now I'm going to leave you with Wendy, so she can ask the next question. The next question has to do with the Minority Health Month. Given the changes in the nomenclature, we do not use the word nomenclature. I'm sorry, we don't use the word minority. And so for you, my question is, what would be the suggestion to replace the name of the month? And we can start perhaps with Linda. Well, it's really difficult. I think it would be good to think of an alternative, something more centered on promoting equity in health and to create awareness about the health disparities that face many of the communities that we're discussing right now, in particular the Latino communities. But for instance, one alternative, the name, it could be something more related to awareness of equity, maybe Health Month or Community Health Month, something that allows us to get away from those terms that occasionally could have some kind of negative connotation or could feel like inferior. We're trying to avoid that. We want to celebrate. We want to celebrate these communities. That's right. And specifically concentrating on equity. Karin? I honestly think that she said it better. Linda already said it. I cannot go better than that. That is the idea, not just focus on the disparities or problems, also celebrating the things that make our communities, to have a lot of faith, a lot of honor, and so to speak, well, I'm going to say it in Spanglish, focusing on our strength, not only the things that are perceived as weaknesses. So, yes, focusing on health, community health, or focusing on equality or equity. Thank you, Karina. I, oh, this is hard. I would say I would add perhaps, well, we kept the word minority, but perhaps it's a community that is growing fast. We have a lot of strength, a lot of power, and if we're given a chance, we will be able to achieve great things. And I think that's what the world has to understand, that Latinos are here. We're going to keep growing. We're going to keep fighting, and we're going to achieve equity. And I like what Karina and Linda said. It would be something like focusing on what gets us together, what joins us, what makes us stronger, and we're here to stay. Thank you. Thank you for those reflections. And I'm going to let Gladys speak to you now. Thank you. Thank you. Yeah, we're here to stay. Okay. Now that we have discussed a lot about CONECTAR and the work that we have been doing, so now we're going to ask very, very quick questions, mostly for for us to get to know you a little bit better at a more personal level. Let's not talk about work anymore. Just fun. First question is, what is your secret talent? Do you have a secret talent that nobody knows? Singing? Whoever? Yeah, who? Oh, I was asking who should go. Oh, yes, anybody. I can start. It is not a secret talent, but honestly, I don't want to presume, but I'm really good at making desserts, baking, and baking bread and cookies, and I love doing so. And I try to avoid doing it during the year, but for the Christmas holidays, my mom and I make dozens and dozens of cookies that we give away to people, and it's something that I love doing. Karin, you want to say something? Well, when I was young, my parents always focused on music a lot. So I grew up playing the piano and also the violin. And so the violin, it's been a while. I haven't done it in a while. I haven't played. But I have a new piano right now, so I'm beginning again. I'm practicing. I listen to the piano and I hear my mom's voice. Practice makes perfect. But practice. Lynette. Well, I'm not going to share mine because then it's not going to be a secret anymore. I used to ride horses when I was growing up in Puerto Rico. I used to compete. I don't do it anymore, but it's something that, whenever, if I go back to Puerto Rico, I would live in a place where I can have a horse, and I would have 2 or 3 horses if I could. Very interesting. Now, one question, kind of strange question. Would you prefer to travel to the past or to the future? Oh, to the future. To the future. The same. Yes, I'm very curious. I would like to see what we can expect, what we should be learning right now to be ready for the future. I think I think it's hard to live day to day, and I worry about the future a lot. So I think if I knew what was coming in the future, I wouldn't have to worry so much. It's very interesting to see how the decisions that we make today are going to give shape to the world of the future. Hopefully, it's good. I also think how things have advanced. For instance, technology. The first iPhone was what, 16 years ago? If we think 16 years till now, I mean, and 16 years from now, what will be the level of technology? What could we expect? How can we design this? Not only that, but how we can use this to support our lives, our personal lives, professional lives. Efren, would you go to the future or the past? Well, that's very interesting. I was thinking about it, and perhaps I would go to the past. Because of, you sort of miss things, the family when my kids were young. I would love to live that again. Of course, I'm interested in the future and what we're doing now. If I had a chance, I would try to see that again. But I would like to relive some moments once again. Wendy, would you go to the past or to the future? I think I've seen a lot of movies. I would not want to go to the past because I wouldn't want to change the future. I think the future, like everybody else said, I'm very curious about it, where we're going to be in 10 years, in 20 years. I would love to see where my children are in 10 years, what they're doing, what professions they chose. So I'm very curious. I think I will go to the future, yes. Very interesting. I also would have thought the future, but it's interesting to listen to the different perspectives that we have. And the next question is about your hobbies. What are your favorite hobbies? One of them. Lynette. I love going to Puerto Rico. All my vacations, every vacation I go to Puerto Rico. On Thursday night, I'm flying to Puerto Rico. Just Puerto Rico or other places too? No, I think that over time, my parents live there, and over time, they're like 60 or 70. And I think, I mean, the 3 years of residency and seeing so many patients, so many sick people, so many families suffering because of their families. I really want to enjoy the fact that they're still there, they're healthy. So every time I get a chance, I go there. And I'm going to be there at a conference from the NIH and the Latin American Student Association. Karim. Well, these days, what I'm doing is I'm running and I'm preparing to run the marathon in Boston, which will happen on April the 15th. So I'm just running a lot all around the place and around Boston. And we're going to see. I'm waiting, for a good day and a good course.
Best of luck. Thank you. Linda, congratulations, Karina, and lots of luck. I need all the luck in the world and the positive vibes for me on Monday. Good vibes. Okay. Well, as all of you know, free time is so limited that I try to, when I can, I try to do the things I like to do, but basically spend time with my family. What we have been doing lately, since the weather is getting nicer, we try to walk on weekends. My husband and I, we take our daughters out. We walk and walk. We stop at the library. We stop for coffee, or we buy some pastries. We take them to the river. Something we have really enjoyed a lot, and we have spent whole mornings doing that on weekends. That's great. It sounds fun. We have two more questions, and the one that's coming up, I'm going to ask everybody, including a friend on Wendy, what is your favorite TV show or movie? A friend? I see that you want to say something. Well, I can tell you that my favorite movie is The Godfather because it's a movie that my dad always liked. And he told me it taught a lot about the family. And so every time they showed it on TV, we would watch it in Puerto Rico. And when they do that here, when they show it, it reminds me a lot of him. So it's not only about the life teachings, but it also, it brings me good memories. Talking about the first one, the second one, third one, which one? I would say the first one mostly. So I would say it's Godfather 1. Wendy, what's your favorite TV show or movie? That's difficult. I like all movies and shows that have to do with spice. But the only movie that I can't not watch if it's on TV is my uh, cousin Vinny. It's so funny. And with my children, I mean, that movie is from what, 1980s? No, no, I don't. Well, it's old. It's an old movie, but it's so good. And well, it really gives me a lot of joy. I share it with my children, and you know, they don't get bored with the movie. They love the movie. So I think that's the one I'm gonna say is my favorite. I don't think I've seen it. I'm gonna put it on my list. You have to. Linda? Well, the show that I like watching when I'm doing the laundry or things like that, program I like to have in the background is those travel shows where they explore culture through food. There's many on Netflix, the Taco Chronicles and street food. And I like the Anthony Bourdain shows very much. So I like that type of program that explores culture through food. I love traveling and I love eating. So I also love that sort of program. It's interesting, but it makes me hungry. True. Karim? I think that a TV show that I liked since it started, I think in 2005, and at that time it was before becoming a doctor, but I started watching Grey's Anatomy, and I have been watching it for the last 19 years. And now I know a lot more, and I know that hospital life is not like Grey's Anatomy, but it's still entertaining anyway, no matter what I know or what I don't know. And doctors are not magicians, of course. The doctors in Grey's Anatomy is like they're trained in 7 different specialties, and that's not the reality. But in the show they had to do everything, so it makes me laugh anyway. And no matter how many times I've watched it, I have laughed, I have cried, all the emotions. I don't think I've watched Grey's Anatomy either. Another one for my list. Another one for your list, but you have to get ready because there's 19 stages, 19 seasons. Yeah, 19 seasons. Okay, we have the last question, and this is about what is your preferred activity in relation to self-care? Let's go to the psychiatrist. Uh, Linda, well, I love exercising. I specifically lifting weights. There's something about feeling stronger every time that I lift weights. It makes me feel real well, and I love feeling stronger every day. So that's something that I've been trying to do more. Now that I'm getting a little older, I need to keep my muscle mass.
¿Y
And
cuánto bench?
how much are you benching?
¿Cuántas pesas usas?
What weights are you using? I can't tell you because I'm embarrassed, really. I don't have any arm strength. I still cannot do a real push-up. So with my legs is a different story. Yes.
Síguele dando nomás, vas a
Okay. Keep doing it. Keep doing it. You'll get there.
Yo diría
Karim,
también para mí es
I would say for me, it's exercise also. Living in Boston, especially in this wintertime when there are not that many hours of sunlight, this process of training for the marathon, I have run outside regardless of whether it's snowing, it's icy, or it's raining. But I think that honestly, in these last months, it has really helped my mental health. Going, it's forced me to go out to breathe fresh air. I always run in the morning, so no matter what happens during the day, at least I have done something for myself.
Excelente.
And so the day is going to be a good day.
La gente que corre porque no me gusta correr.
Well, I admire people who run because I don't like running. So, Lynette,
A mí tampoco me gusta correr mucho.
I don't like running either.
A mí me gusta ir al gimnasio, pero prefiero ir a hacerme las uñas.
Well, I like to go get my nails done, go to a podologist there to get, that's my self-care, manicure and pedicure.
¿Tú quieres responder esa pregunta, Fran?
So, do you want to answer that question, a friend?
Para mí, si yo digo
To me,
self-care, o sea, lo que digo para que me, ¿verdad? Distracción, yo diría,
self-care, I mean, something to
¿verdad? Practicar
uh,
el hacer algo por
entertain
la
myself, to
practicar
have fun is
algo
just,
por barbecuing,
barbecuing, grilling meat. That's like therapy for me
la comida,
because I have
lo
to
que para
focus on the food regardless of what has happened.
la comida
If it's
esté
been a stressing day, and I need to make sure that
que
the
lo
food is good.
siempre
And I like when people enjoy my food and there's no leftovers. When is your birthday? No, just kidding.
Wendy.
Wendy?
Bueno, para mí sería
Well,
aparte
to
de
me,
pasar tiempo con mi
besides
familia,
spending time with my family and
una
really
cena juntos o
uh,
salir juntos,
dining together or going out together, I also love running. It makes me feel free and I forget about all my worries because I'm focusing on just going and having the energy, the endurance to continue running. But of course, after the run, I come back to earth very quickly because my knee pain, since I'm a little older, my knees fail me sometimes.
Pero a seguir adelante, ¿no?
But let's keep moving forward.
¿Y para ti,
Okay.
Gladys?
And for you,
Oh,
Gladys? Oh,
me encanta hacer el boxing.
I love
Hace-
boxing.
hace-
I started doing it
antes de la pandemia.
a little bit before the
Antes de la
pandemic.
pandemia,
I
y
stopped during the
llevo un
pandemic
año más.
and I retook it
Y
about
me
a
encanta
year
hacer
ago
ejercicio
and I
porque
love it.
terminas
It's
súper
exercise.
relajado.
I mean, you end up
Me encanta.
really tired, but really happy.
Bueno, me voy a poner una nota, nunca me voy a pelear con Gladys. Siempre
Okay,
vamos a
note to
pelear
self,
por
never fight Gladys. I'm gonna end up with a lot of with a black eye. No, we only fight the big punching bags,
Nunca
not
le voy a
people.
pelear.
In any case, I'm never gonna fight you.
No, yo soy inofensiva.
I'm not really
La siguiente
dangerous.
con el
No, no worries. Okay, next stage, we move on with a friend. Okay, I wanted to ask you, Wendy, and I wanted to ask the panelists if they had any final thoughts before we finish. This has been a very entertaining conversation. Any last words from the panelists before we close the session?
Gracias por la oportunidad.
I would say thank you for the opportunity. It's been a pleasure. It's been an honor to be part of this group. And I will be here for the next 3 years. And I would love to continue collaborating. Same for me. I'm just very grateful for being part of this group, to be able to give something to contribute to our communities, mainly, in the language that they speak. So thank you very much. And again, very happy to be a part of this group.
Same here. It's an honor, it's a privilege to be able to share. And I would just tell the audience, thank you for listening to us. Thank you for giving us your time, because we know that you always are very busy. And also, let us know if there are any topics, anything that you want to hear, perhaps questions that you don't know where to go ask. Perhaps our organizers, they have not just us, we have over 60 physicians in different specialties. We want to make sure that we provide you with the information that you need, that will be useful and interesting to you. And we're here to support you. Thank you. And so we're going to conclude. We're going to say goodbye. I wish we could stay here having this conversation. I love, I also love, baking for Christmas and for the holidays. We do that in Puerto Rico. I was just thinking of having a cup of coffee with dessert right now. But well, at any rate, it's a pleasure. With a barbecue, yes, of course, a barbecue. Let's do that. If you invite us to the barbecue, I will take dessert. I will take either dessert or a little bit of ceviche. Whoa. Yes. Well, thank you so much. Thank you to all the panelists that were here with us, to the moderators, Wendy, Gladys, Natalie, who's here with us also, and she's an essential part of the group also. She's backstage, but honestly, she's here too. So we want to let you know that we are celebrating not only 3 years of CONECTAR, but we have great times together. We have, for instance, the meetings with El Planeta, Java with Jimmy. When we met with them, we have Natalie, Claude, Jimmy, Karina, and myself were there. So perhaps the other thing we can say is here, the next slide. We have Natalie right here. And so you not only have the impact that CONECTAR has, this is something that we do with a whole lot of passion, and it does have a big impact on our community. And this is something that we've been able to quantify. We've been able to see how many people we are able to reach through this media. And this is something that we have been able to present at different events, conferences. We have published this. We have Juan Villa, who is a colleague, a radiologist. He has made presentations about breast cancer in Un Minuto de Salud, a Minute of Health, with El Mundo in Boston, this morning show. So the other thing that we wanted to let you know is please stay connected to us. You can connect with us via email using any of the other platforms, X, formerly Twitter. And here's our information. You have Claude Alabre, who is an internal medicine doctor, Natalie Johnson, who is the administrative director. She is the one that works on engagement here, Dr. Gladys Pacha. And she is one of the directors of the addiction program. And you have the ways that you can connect with her. Wendy Macia, who's also here with us. She's our sponsor. She sponsors our job, and she is a leader in the hospital. And Efren Flores here at your service. And we want to thank you so much for being here. And on this slide, this is an expression of gratitude for being here with us, and to all the panelists for giving us their time today to talk to you. We thank them also for all the work that they do. And this is, we thank you also for how you connect with your patients and this dedication to what you do. And this is something that is so evident when you listen to the conversation today. And this is something that fills me with pride, the pride of being here. And with a lot of humility, I thank you all for your time. And Natalie, I wanted for you to say hola, say hi. Hi, everybody. My name is Natalie Johnson, and I'm the director of the Office of Belonging and Engagement at MPH, and it's a pleasure to be here today with you. This is a very powerful group. Thank you so much, everybody. Thank you, Natalie. Thank you, everybody. Thank you, everybody that has been here, and the entire team for this really great time that we were able to share together. So stay connected for the second part of the discussion for CONECTAR. Thank you for everything. And good evening, good morning, whenever you are listening to this.